At this very moment, as you're watching this video, your legs and feet might be trying to warn you about something serious, your heart. But most people completely ignore these early warning signs. Right now, over 6 million Americans are living with congestive heart failure. And here's the shocking part. Most of them had no idea that their swollen ankles or constantly cold feet were their body's way of screaming for help. We often think chest pain is the main sign of a heart problem, right? But that's not always true. Studies show that 94% of people miss the early symptoms of heart trouble, simply because they think it's just old age, tiredness, or maybe standing too long. That swelling in your ankles you blame on your new shoes. That numbness in your feet after a long day at work, they might actually be your heart's final attempts to get your attention. So before we dive deeper, hit that subscribe button and turn on notifications if you care about your health. Because here, we uncover the truths most people don't talk about. Now, if this topic connects with you, drop a 1 in the comments. If not, type 0. Trust me, your comment matters more than you think. Today, we'll go over 12 signs in your legs and feet that can reveal early heart failure, all backed by real medical research. Recognizing these signs early could literally save your life, and stay with me till the end, because symptom number 9 happens at night and affects over 78% of people with heart failure, but almost nobody realizes it's linked to the heart. Let's get started. Symptom 1, cold feet that never warm. Most of us laugh off cold feet. We think we just need thicker socks or better circulation. But here's what's really happening. When your heart starts to weaken, it has to make a tough choice. It can't pump blood everywhere efficiently, so it sends the limited blood it can move to your most vital organs: your brain, lungs, kidneys, and of course, your heart itself. Your feet? Sadly, they're at the bottom of that priority list. Research published in the journal Circulation found that people with reduced heart function often experience persistent cold feet as one of the very first warning signs. It makes sense. Your feet are the farthest from your heart and require extra effort to keep blood flowing properly. Here's how you can tell the difference between normal cold and heart-related cold. If your feet stay cold no matter what you do, even when you're warm, moving around, or wearing thick socks, that's a red flag. It's your heart struggling to deliver enough warm, oxygen-rich blood to your extremities. So if your feet are always icy, even when the rest of your body feels fine, it might be time to check in with your doctor. Symptom 2, the finger press test. Hidden swelling. You can try this simple test right now. It's something doctors use all the time. If your ankles or legs look puffy, press your finger firmly into the swollen area for about 10 seconds, then let go. If a deep dent or pit stays there for a few seconds before disappearing, that's called pitting edema, and it's a classic sign of heart failure. Here's what's happening. When the right side of your heart weakens, it can't properly pump blood back up to your lungs. That creates a backup. Blood pools in your veins. Pressure builds and fluid leaks into nearby tissues. That's the swelling you see. And that little dent from your finger, it's your body showing you how saturated those tissues have become. According to the American Heart Journal, pitting edema is one of the clearest signs of right-sided heart failure. It's your body's way of saying, hey, something's seriously off with circulation. So if your legs or ankles are swollen and the dent test leaves an imprint, don't ignore it. It's a direct message from your heart asking for help. Symptom 3, sudden leg weakness. When your muscles are starved for oxygen, have you ever noticed your legs suddenly feeling weak? Like walking up the stairs or carrying groceries feels harder than it used to? That's not just getting older or being out of shape. It might actually be your heart struggling to keep up. Here's why. When your heart can't pump blood efficiently, your leg muscles don't get enough oxygen or nutrients. Without that fuel, they start to lose strength, literally on a cellular level. A major study in Circulation, Heart Failure found that patients with weakened hearts often had significantly weaker leg muscles, not because they didn't exercise, but because their heart couldn't deliver what those muscles needed. Think of it like this. Your heart is the engine, and your muscles are the car. If the engine can't deliver fuel properly, the car sputters. Same thing happens with your legs. They start to feel heavy, shaky, or jelly-like even after light activity. So if things like climbing stairs or walking short, distances suddenly feel exhausting, even though you haven't changed your lifestyle. Don't ignore it. That weakness could be your heart quietly asking for help. Symptom 4. Sudden weight gain. Your body holding on to fluid. Here's a big one that surprises a lot of people. Fast weight gain, like 5 to 10 pounds in just a few days, can actually be a warning sign of heart failure. Now, before you think I must have eaten too much, hear this. That weight isn't fat, it's fluid. When your heart isn't pumping blood effectively, your body starts to retain water. Fluid builds up in your tissues, especially in your legs, ankles, and feet, making you look and feel swollen. According to research from the Mayo Clinic, this kind of rapid weight gain is one of the top red flags that needs immediate medical attention. It's your body's way of saying, hey, circulation is breaking down here. So if you step on the scale and notice you've gained several pounds seemingly overnight, especially if your shoes or pants feel tighter around your calves, that's not just bloating. It's a serious sign that your heart might be struggling to keep fluid levels balanced. Doctors say if you gain more than 2 or 3 pounds in a day or 5+ pounds in a week, that's a reason to get checked right away, because the earlier you catch it, the easier it is to treat. Symptom 5. Blue or dusky legs. When blood isn't getting enough. Oxygen. Have you ever looked down and noticed your legs or feet looking kind of bluish or darker than usual? That's not just a weird lighting issue. It's your body literally showing that your blood isn't getting enough oxygen. Doctors call this cyanosis, and it's one of the most visible red flags that your circulation is in trouble. Here's what's going on. When your heart can't pump efficiently, blood starts to move more slowly, especially to your lower body, where gravity keeps it pooling around your legs and feet. Because that blood isn't carrying enough oxygen, it gives your skin a bluish or purplish tint. The European Society of Cardiology reports that this discoloration is one of the clearest signs that the heart is struggling to deliver oxygen-rich blood where it's needed. You might notice your toes or ankles looking dusky after sitting or standing for a while. That's when gravity makes it worse, and as heart failure progresses, that color change can move higher up your legs and become more noticeable throughout the day. Bottom line, if your legs look unusually blue, gray, or dark, don't brush it off as just cold feet. Your heart could be trying to tell you something serious. Symptom 6. Swollen ankles that don't go away. The hidden pressure. Build up a little ankle swelling after a long day might not sound like a big deal, but if it keeps happening or gets worse by nighttime, it's a sign you shouldn't ignore. This kind of swelling, called edema, is one of the most common early signs of heart failure. Here's why. When your heart starts to weaken, it can't push blood through your veins as strongly. That creates a traffic jam in your circulation, and pressure builds up in your veins. Eventually, that extra fluid leaks out into nearby tissues, usually settling in your ankles because gravity pulls it downward. Studies in the Journal of the American College of Cardiology, JACC, found that ankle swelling isn't just common in heart failure. It's one of the most reliable signs of how severe the condition might become over time. You'll know it's heart-related swelling if it doesn't go away after resting or elevating your legs. It gets worse as the day goes on. Your skin feels tight, shiny, or leaves a dent when pressed. Remember the pitting test? If your ankles are noticeably puffier every evening, and especially if your shoes suddenly feel tight, it's time to take it seriously. Your heart may be struggling to keep fluid moving, and it's showing up right at your feet. Symptom 7. Slow healing sores on legs or feet. Circulation. Trouble at work. Let's talk about something most people never connect to heart problems. cuts or sores that just won't heal. Maybe you scraped your leg or got a blister on your foot weeks ago, but it's still there. Slow to close up or even getting worse. That's not just bad luck, it's poor circulation. Study in the Journal of the American Medical Association, JAMA, revealed that people with heart failure often struggle to heal from even small wounds. Why? Because their tissues aren't getting enough oxygen and nutrients, the very things your body needs to rebuild and repair skin. Think of it like trying to build a house with no delivery trucks. The materials just don't reach the site. That's what's happening when your heart can't pump strong enough, immune cells and healing proteins can't reach the wound. So if a small sore on your leg or foot lingers for weeks or months, it's not just a skin issue. It could be a major warning sign that your heart isn't delivering blood where it needs to go. And here's the scary part. Untreated, these wounds can turn into serious infections. So don't wait. Talk to a doctor as soon as you notice slow healing spots on your lower legs or feet. Symptom 8. Leg cramps. While walking, your body's low oxygen alarm if your calves cramp or ache every time you walk, but feel better when you stop. That's not just a muscle issue. It's actually a warning sign that your blood flow is being restricted. Doctors call this claudication, and it happens when your heart and arteries can't supply enough oxygen to your leg muscles during activity. As soon as you stop walking, the demand drops, the pain eases, and you think it's fine. But here's the truth. Claudication is one of the most overlooked symptoms of peripheral artery disease, PAD, which is strongly linked to heart failure and blocked arteries. According to research from the American Heart Association, nearly 1 in 4 people with heart disease also have PAD, and leg cramps are their body's first SOS signal. If you find yourself slowing down during walks because of burning, tightening or cramping pain in your calves, especially if it goes away with rest, your muscles are literally begging for oxygen, and that means your heart may not be keeping up. So next time you feel those random cramps, don't just grab a banana or drink more water. Check your circulation, because that pain could be coming straight from your heart. Symptom 9. Restless legs or nighttime leg discomfort. Your heart keeps you awake. This one shocks a lot of people. You lie down at night ready to rest, but your legs won't stay still. They twitch, tingle, or ache until you move them. Doctors call this restless legs syndrome, RLS, and it's far more connected to heart health than most realize. A massive study in the European Heart Journal found that nearly 78% of people with heart failure experience nighttime leg discomfort or restlessness. Here's why. When you lie flat, your body's fluid levels shift. Blood and retained fluid from your legs move upward. That sudden change can increase pressure in your heart and lungs, making circulation uneven. Your brain senses that imbalance and triggers those creepy-crawly sensations in your legs to make you move, to help blood flow again. So the constant urge to move your legs at night might actually be your heart's way of saying, "I'm under strain." You'll know it's heart-related if it's worse when you lie down or try to sleep. Moving your legs or sitting up gives quick relief. You often wake up tired, even though you slept. Most people blame stress, caffeine, or poor sleep. But if this happens regularly, it's time to look deeper. Your restless legs might be restless because your heart is restless too. Symptom 10. Shiny, tight, or thin skin on your legs. The silent fluid. Warning, take a close look at your lower legs. Does your skin look shiny, stretched, or thinner than before, almost like it's under pressure? That's not just aging. It's a classic signal that your body is retaining too much fluid because your heart isn't pumping properly. When circulation slows, blood and fluid build up under the skin, especially around your shins and ankles. Over time, that swelling stretches the skin so much it becomes glossy, fragile, and more prone to cracks or infections. The Cleveland Clinic notes that shiny or stretched skin on the legs is one of the most visible external signs of chronic heart failure, and it often appears before other serious symptoms. You might even notice that your leg hair has stopped growing, or your skin itches frequently. That happens because the stretched skin cuts off tiny capillaries and oxygen supply to the area. If your legs look too smooth, or you can literally see light reflecting off the surface, it's time to pay attention. That shine isn't beauty, it's a warning. Symptom 11, leg pain. Even at rest, the final stage, circulation. Breakdown, when your heart can't deliver blood efficiently anymore. Even resting becomes painful. At this stage, your arteries are so narrowed or your heart so weak that your muscles ache even when you're sitting or lying down. This is called critical limb ischemia, and it's exactly as serious as it sounds. People describe the pain as burning, throbbing, or deep aching in their calves or feet, especially at night when they're lying flat. You might even have to hang your legs off the edge of the bed just to get relief. Why does that help? Because lowering your legs uses gravity to pull a bit more blood into them. But that's a temporary fix. It's your body's desperate attempt to get oxygen to starved tissues. The National Heart, Lung and Blood Institute warns that if this pain is ignored, it can lead to ulcers, infections, and in extreme cases, tissue death. So if you feel persistent leg pain even when you're not moving, don't wait. That's a flashing red light that your heart and your circulation are in serious trouble. Symptom 12, constant fatigue and heavy legs. When your heart is running out of energy, this one ties all the others together. You're not doing anything unusual, just your normal day, but you feel drained, your legs feel heavy, your body feels weak, and even small tasks seem exhausting. That's what happens when your heart can't keep up with your body's demand for oxygen and nutrients. Every cell in your muscles is basically starving, so your body starts rationing energy. You feel like you're moving through mud, slow, tired, and unmotivated. The Mayo Clinic confirms that chronic fatigue is one of the earliest and most persistent signs of heart failure. It can show up months before swelling or chest pain ever appear. So, if your legs constantly feel heavy, if you get winded from basic chores, or if your energy seems to vanish every afternoon, don't just push through it. Your heart could be quietly signaling that it's struggling to keep up. Final message: listen before it's too late now. Here's the truth. Your heart doesn't fail overnight. It whispers for months, sometimes years, through your legs and feet. Cold toes, swelling, color changes, cramps, fatigue. They're all messages from your body asking for help. If you recognized even one of these symptoms, don't panic, but don't ignore it either. Get a checkup. Ask your doctor for a cardiac evaluation or an echocardiogram, because when it comes to heart failure, early detection can make the difference between recovery and regret. And if this video helped you understand your body a little better, please hit the like button, drop a U in the comments, and share it with someone you care about. You never know. It could save their life. Stay healthy, stay aware, and as always, take care of your heart.